Home Care Academy, a service from Sequoia Senior Solutions, presents how to have effective communication with a person affected with Alzheimer's disease, with tips on how to prevent and diffuse frustration and how to become a better listener. Your facial expression, your body language, and the tone of your voice are extra important when speaking to a loved one with Alzheimer's disease. It is also important to approach her from the front to avoid startling her. If your loved one is sitting, sit down when talking to her. Also, make sure you have some light on your face. This will help the person who has Alzheimer's disease to see the expression on your face and understand what you say and what you mean. Maintain eye contact as you speak. If there's a chance your loved one will not remember who you are, set aside your pride and say your name. Do not shout, as shouting makes understanding more difficult. This is true for everyone, but particularly for people with Alzheimer's. Do not show anger. Use simple, direct statements and information. Use words your loved one is presently able to understand. Do not give more than one instruction at a time. Do not press for an answer if that worries or confuses your loved one. Ask questions that require a yes or no response if that aids in conversation and understanding. When speaking to a loved one who has Alzheimer's, keep the conversation simple. Giving one-step directions, such as place the fork on the table, rather than can you please set the table, can be very helpful when communicating with a person who has Alzheimer's. Ask only one question at a time. Identify people and things by name, avoiding pronouns. Be positive. Instead of saying, for example, don't go outside, say, let's sit down and have a cup of tea. If the person with Alzheimer's has difficulty understanding what you're saying, find a different way of saying it. If he did not understand the words the first time, it is unlikely he will understand them a second time. Try to reduce background noise, such as from the TV or radio, when speaking. In addition to making it harder to hear, the TV or radio can compete with you for your loved one's attention. Be patient. Encourage your loved one with Alzheimer's to continue to express her thoughts even if she's having difficulty. Be careful not to interrupt. Avoid criticizing, correcting, and arguing. Most of all, be patient and forgiving to yourself. Providing care to a family member with Alzheimer's disease is an honorable but formidable task. For assistance and inquiries, feel free to visit our website or call this number to find out how we can help you care for your loved one.